About 1 in 4 adults over 65 falls each year, though some older studies have cited rates as high as 1 in 3. By age 80, that number climbs closer to 1 in 2. Most of those falls are not random bad luck. They follow a pattern, a slow, quiet decline in the nervous system's ability to sense where the body is in space and correct its position before control is lost. That process begins in your 60s, and it is largely reversible. Today, we are going to look at what the research says about balance training specifically, not general exercise, not walking, but targeted balance work. How little you actually need to do, what the exercises look like, and how to start safely, whether you are 65 or 85. The most comprehensive review on this topic is a 2019 Cochrane analysis led by researcher Catherine Sherrington. It pulled together 108 randomized controlled trials, more than 23,000 participants. That is a large, solid foundation. The headline finding, exercise overall, reduces fall rates by about 23%. But when the researchers looked specifically at balance and functional exercises, things like standing on one leg, stepping drills, and weight shifting, the reduction held at 24%, with what researchers call high certainty evidence. That is the strongest rating a body of evidence can receive. Add resistance training on top of the balance work, and the benefit rises to around 34%. A 30% reduction in falls is not a small thing. At a population level, it translates to hundreds of thousands of fractures and hospitalizations prevented every year. At an individual level, it is the difference between a life that stays open and one that contracts. One more finding worth knowing. The Otago Exercise Program, a home-based protocol tested across 4 randomized trials published in the BMJ in Age and Aging, showed a 35% reduction in falls and fall-related injuries, and the benefit was greatest in adults aged 80 and older, not younger adults, older ones. That matters because this is not an intervention that fades out just when people need it most. Balance depends on 3 systems working together in real time: your eyes, your inner ear, and the pressure sensors in the soles of your feet. The brain takes all 3 signals and makes tiny, constant adjustments, most of them below conscious awareness. After age 60, each of those input channels becomes a little less precise. The sensors in the feet lose sensitivity. The inner ear's response slows slightly. Visual processing takes a fraction of a second longer. None of these changes is dramatic on its own. Together, they add up. Here is the encouraging part. The nervous system does not stop learning. Motor neuroscience is clear on this point. The brain retains meaningful plasticity for balance-related learning throughout the lifespan. When you practice controlled, mildly challenging balance work, you are not just building muscle. You are retraining the neural pathways that keep you upright. There is also a psychological dimension worth naming. Research consistently shows that fear of falling is itself an independent risk factor. When people become afraid, they move less. Moving less accelerates muscle loss and further impairs balance. It is a cycle that tightens over time, and targeted balance practice is one of the few things that directly interrupts it. Confidence often begins to return before the physical improvements are fully measurable. You do not need a gym. You do not need equipment to start. A sturdy kitchen chair, a clear patch of floor, and 2 or 3 sessions per week is the evidence-based starting point. Here is a simple progression. Begin with supported single-leg standing. Stand behind a chair, hold the back lightly, and lift 1 foot just off the floor. Aim for 10 seconds per leg. Work toward 30 seconds without gripping the chair. When that feels controlled, move to tandem stance. 1 foot directly in front of the other, heel to toe. Then try slow eyes closed, standing on a firm surface with the chair close by. Pair that with functional movements, the transitions where most falls actually happen. Heel to toe, walking along a line. Sideways stepping, sit to stand from a firm chair without using your hands, 8 to 10 repetitions. These are not abstract exercises. They mirror stepping off a curb, turning in a hallway, getting up from a sofa. Neurological adaptations begin to appear within several weeks of consistent practice. Structural improvements in lower limb coordination are measurable by 8 to 12 weeks. The key word is consistent. The gains require ongoing practice to maintain. If you prefer a structured program, the Otago Exercise Program materials are publicly available at no cost. For group settings, Tai Chi has a meaningful evidence base. The same Cochrane review found it may reduce fall rates by around 19%, and classes are widely available at community and senior centers. A few situations call for a conversation with your doctor or a physical therapist before you begin unsupervised balance work. If you have a vestibular disorder such as BPPV, significant peripheral neuropathy in your feet, moderate to severe Parkinson's disease, orthostatic hypotension, blood pressure that drops when you stand, or a recent fracture or joint replacement in the past 3 to 6 months, please get professional guidance first. If you have had an injury-causing fall in the past 6 months, or if you currently use a walker, start with 2 points of stable contact at all times. That is not a limitation. It is where the validated protocols begin for higher-risk individuals. During any session, stop and sit down if you feel sudden dizziness or a spinning sensation, chest discomfort, shortness of breath that seems out of proportion to the mild effort involved, or a headache that comes on quickly. Those symptoms warrant a call to your healthcare provider before you continue. One more practical note. Before every session, clear the area of loose rugs and cords. Wear flat, closed-toe shoes, not socks alone, not loose slippers. And position yourself near a chair or countertop that is stable enough to catch you if you need it. Two things come up often when discussing this topic, and they are worth addressing directly. The first is walking. Many people assume that walking every day covers their balance needs. Walking is genuinely valuable for cardiovascular health, for mood, for general function, but it primarily trains forward movement at a comfortable, self-selected pace. It does not train the lateral stability or the rapid postural reactions involved in catching yourself mid-stumble. Walking and balance training work well together. They are not interchangeable. The second is a belief that unsteadiness is simply who you are, a fixed trait, part of your particular constitution. The evidence does not support that. The Sherrington Review found significant improvement across all age groups studied, including adults in their 80s and 90s. Poor balance in older adults is overwhelmingly the product of disuse and accumulated sensory decline, not destiny. That is genuinely useful information. No intervention eliminates every fall. That is not the goal, and it would not be honest to suggest otherwise. The goal is meaningful, achievable risk reduction, the kind that keeps a life open rather than letting it quietly close. A 30% reduction in fall risk from 2 or 3 sessions a week at home at no cost with measurable results within a few months. That is one of the better evidence to effort ratios in senior health research. Start supported, progress slowly, be consistent. If this kind of practical, evidence-grounded information is useful to you, consider subscribing. We publish regularly for adults over 55 and the family members who care about them. No hype, just what the research actually says and what you can reasonably do with it.